Greetings. This is Dr. Carl Golnick, Chair for Education for the Ophthalmology Foundation and Chair of the Committee on Accreditation. I want to say a few words about our new ophthalmology training program, accreditation program. I have no relevant financial interests. Just a word about accreditation versus certification. Certification is a term that we use for individuals if they're meeting certain standards, whereas accreditation is reserved for programs that meet certain standards. So one definition of accreditation is a review process that determines if a training program meets defined standards of quality. If the program is accredited, the program's curriculum, quality have been evaluated and judged to meet the standards of the profession. Real purpose of accreditation is several-fold. It protects the public, it protects the residents' education, hopefully it improves patient care, and should drive program improvement. It sets a bar that should be high enough to meet standards, but not so high that one cannot clear the bar. To that end, the World Federation for Medical Education has created a template for postgraduate medical education. And their purpose for this document was for people like the Ophthalmology Foundation to take their template and apply it to our specialty of ophthalmology. Therefore, our accreditation guidelines have the same main sections as the WFME document, 1 through 9. I won't read them here. We've added 2 more: surgery, since ophthalmology is a surgical profession, and resources. From the accreditation guidelines, we've created a self-assessment guide that is designed for programs to look for gaps. Where are the most important parts of the program that need to be improved? And there are 2 levels of accreditation: basic and advanced, which are spelled out in these documents. The process is fairly simple and standard. The program completes a self-assessment. The accrediting agency, in this case, the Ophthalmology Foundation, reviews that self-assessment. And if it seems like the program has a good chance to pass the accreditation, we then schedule a site visit. If we don't think so, we give feedback on what needs to be improved before we actually do the site visit. And the principle behind the site visit is trust what is said in the self-assessment, but verify it with the various stakeholders and groups in the program. And then an accreditation decision is made. This is not a lifelong accreditation. It's not forever. And it's typically 5 years. Of course, we supply suggestions for improvement. And then when reaccreditation comes around, we look first at those areas that we've recommended improvements in. So in summary, program accreditation is a structured process designed to drive program improvement. It protects the student's education and ultimately improves patient care. You can learn more about our Ophthalmology Foundation accreditation program at this link and download documents that are relevant, and of course, contact us if there are further questions. But we hope to be working with you sometime in the near future, and good luck with your program improvement.